and state-of-the-art regional hospitals and medical facilities. The Guyana Dialogue is being sponsored by Coordinating Council of Guyanese based in the US, UK, Canada, Guyana, and the Caribbean. Funding support is by well-known philanthropist Dave Narayan from Dave West Indian Imports. Please welcome my moderator for tonight, Dr. Tara Singh.
Thank you very much, Shamisa, and welcome
Good
to our
evening.
viewers.
Our panelist tonight is Dr. Ganga Ramdas.
Hello, everyone. Good evening.
Good evening. And our guest tonight is the Minister of Health, the Honorable Frank Anthony.
Good evening, everyone.
Good evening, everyone. Dr. Tara.
Yeah, thank you, Shamisa. Good evening again to all our viewers and the panelists, including our guest, Dr. Frank Anthony, who is a Senior Minister of Health. Before we start, I'll ask Dr. Frank to make an introductory remark about the state of health in general terms in Guyana.
Well, thank you very much, Dr. Tara Singh, and thank you for having me on the program. As you know, over the last 3 years or so, we've been working very steadily to improve healthcare in Guyana. And we have been doing so at every level. So whether it's primary, secondary, or tertiary level, we have been working in these directions. We've also been working on expanding various types of programs. So the services that we offer is now expanded. What we used to do previously, we have now expanded all of that. And we're taking a lot of services into the rural communities. So where people did not have access to certain services, they can now have those types of access. So one good example of that is, for example, in Region 9, persons who had cataract, for example, in many instances, they didn't have any service there. So we are sending in ophthalmologists who would check these persons. And if they diagnose them with cataract, we'll put them on a list and then fly them out to Port Morant Hospital, where we have the National Ophthalmology Hospital, and we're able to do cataract surgery for them. So, places where persons did not have access to care, we are now providing that. So I think over the last couple of years, you would have seen steady improvement in the healthcare system in Guyana. And in the next 2 years, you will see some remarkable development as we move forward.
Just one clarification. The patients who come up to Port Moran for cataract surgeries, how much does it cost them?
It doesn't cost them anything. The government would take care of everything. So from identifying the patients, giving them a flight from, let's say, Lethem to Georgetown, and then transporting them to Port Morant, keeping them in the hospital at Port Morant, operating on them, then when they're well, to send them back into their community. All that cost is borne by the government. So it's free of cost.
Thank you. If someone is on the waiting list, how long would that person have to wait before he or she receive surgery?
So generally within a month, we'll be able to do cataract surgery for the person.
Okay.
Well, one of the things, the Port Morant Hospital, the ophthalmology hospital, when we came back, that hospital, all the theaters were down, the microscopes, everything was destroyed. And so we literally retooled that hospital, rebuild it, and then staff it again. And that's why we're able now to do these types of surgery. So we have 3 operating theaters there with modern equipment. And we have a number of ophthalmologists. Some of them are local doctors who've trained in ophthalmology, but we also have a team of Cuban doctors that are located there.
Okay, thank you very much. I have received quite a few calls in relation to 2 communicable diseases, particularly diabetes and hypertension. Now, I know that your ministry is giving each diabetic patient who's on dialysis $600,000 per year. But what preventive plans you have to reduce diabetes or even to eliminate it?
The big challenge that we have in Guyana is there are lots of people who are diabetic. So we estimate, not only our estimate, but the International Diabetic Federation would have estimated that in Guyana there are approximately 66,000 persons who are diabetics. So that's quite a lot of people. Now, we decided that we want, for those persons who are diabetic, we want to offer them better care. So, one of the projects that we are right now working on is to improve care for diabetics. So, once you've been diagnosed with diabetes, we want to make sure that we can help you to control your blood sugar and bring it down to normal levels. And to do that, we have been across the system, the public healthcare system, we have changed the medication that we are offering at each of our clinics. So we are following a protocol that has been developed by the Pan American Health Organization. It's called HEARTS D, and D meaning diabetes. And so that's the protocol that we've been using. And we're using medication that has been more effective in treating patients. In addition to that, over the last 2 months or so, we've been working with a team from Mount Sinai to develop new diabetes guidelines. And you would see us launch those guidelines in July. Having completed the launch of the guidelines, we'll be training primary healthcare doctors in the use of the guidelines. So that would also happen in July. And then we'll be rolling out a very comprehensive program to get people on this type of treatment. One of the challenges that we have is that we still use glucometers, and we have been using the traditional methods to check whether or not somebody is diabetic. But we feel that the HbA1c is a more reliable marker. And so, one of the things with these new guidelines is that we'd be benchmarking using HbA1c. And we have bought a number of these machines that we'll be putting in primary healthcare settings. Our objective is to make sure that every health center would have one of these. So, when patients come in, we can do their HbA1c at the clinic level. And so, get a better understanding of what is happening with the patient. HbA1c would give you an estimate of what the blood levels, the sugar levels in your blood would have been over the last 3 months, versus when you come in and you check with one of these strips, that is just telling you what is going on with you at that moment. So the HbA1c is much more reliable, and that's why we're going to shift to using that. So you'll see a lot of changes in terms of how we manage diabetic patients. We're also working to improve the management of complications that diabetic patients would have. So we have started to improve our foot clinics. We have had quite a number of programs dealing with foot care. Unfortunately, a lot of these programs would have fallen to the wayside, so we're now restoring some of them. So foot care is very important. We are working to make sure that we can offer people shoes that are appropriate for diabetics. So these are weight bearing shoes that would help to spread the weight evenly. We are also helping patients to access eye care because you know a lot of diabetics they need to check their eyes on a regular basis, and so we are able to screen their retina for them on a regular basis. Right now, we have 5 sites where that can be done, and we'll be improving and adding more sites as we go. And we are introducing tele ophthalmology, where we can check the retina of patients, store those images so that we can compare when we first saw them whether there's a deterioration. And as you also mentioned, kidney care. This is another area for those who need dialysis. We're offering them $600,000 to assist them with dialysis. Now, in terms of how do we prevent all of this from happening, we need to do massive education with our population. So you will see us launch very shortly a program where we'll be talking to the population about the importance of diet, exercise, management of stress, getting adequate sleep, talk to them about connectivity with family and friends. So, all of this is important in terms of wellness. And part of the ministry's chronic non communicable diseases department, we would also be launching a wellness program. So, it's not just about when somebody gets sick, when they have a disease, that we are, helping them to manage the disease. But we want to do a paradigm shift where you try to keep people healthier for a longer period, and that means that you have to help them to mitigate those risks of disease. So that's what that program is all about. But during September, we'll be launching a very innovative, very creative program uh, to help people with chronic non-communicable diseases.
I just want to ask you, a patient who's at home, who's a diabetic, how would that patient monitor his sugar level? He has to get it done at the hospital or a nearby clinic, or is there any provision to provide them with some device where they can test it at home?
At this point in time, we are not giving each individual patient a glucometer, right? So if patients want to monitor at home, they would have to buy that glucometer on their own. But at our clinics, we have glucometers, and now we're going to introduce a machine that can test for HbA1c at most of the clinics. So when they come to clinic, they would be able to get those checks at the clinic.
Okay, diabetes is closely related to hypertension.
Mhm.
Can you speak a little about the incidence of hypertension and what treatment methods are available, including preventive measures as well?
So again, the HEARTS program that I mentioned, that is specifically HEARTS looks at cardiovascular disease, including hypertension, and HEARTS D is the cardiovascular disease plus diabetes. So we have right now more than 100 clinics where we have changed the medication using the HEARTS protocol. And we are hoping to add maybe another 50 or so clinics during this year. Medication are different, they're more effective, and we have seen better control using these types of medication. It's a program that we've been collaborating with the Pan American Health Organization, and we are able to procure these meds at a cheaper cost through the Pan American Health Organization's strategic fund. So they're better medication, but we actually get them at a cheaper cost because PAHO buys in bulk, and we're able to use that strategy so that our patients in Guyana can benefit from it. So far, by introducing HEARTS, we are getting better results, and we are hoping to continue this. But in addition to introducing HEARTS, the preventative side is also important. So, talking to people about diet, talking to people about reducing salt, these are all important things. And of course, exercising. This is also very important.
Um, you said you will begin a program of education throughout the country. Are you planning to have or integrated with health education in schools?
Yes.
Years ago they used to have a class called or a topic called hygiene. I don't know if that is still
They have a family health and family life education program in most of the schools across Guyana now.
Okay.
So I think that's the name they've replaced the
Okay.
what you would have known as hygiene before.
Uh,
But they do a number of things using that program. So we'll definitely be working with the Ministry of Education to talk to the children more about their health. But one of the other things that we're introducing in schools, starting from next month, is a screening program for school children. Our ultimate goal is that while you're at nursery school, that every child at nursery level would be screened by the Ministry of Health at least once. And then when you get into secondary, during your primary years, during those primary years, you'll be screened at least once. And then during secondary, you'll be screened another time, on another occasion. So you basically get three screening during your school life up to secondary, and we'll be able to document whether or not you have any challenges. Why this is important? Because we find that sometimes kids would come to school, they're not seeing properly, but the teacher might not be able to detect that his child is not seeing properly. And, for want of spectacles, that child might have learning loss because they're not seeing well, or that child might have a difficulty hearing. So by screening them early, we can detect these things because our intention is to screen for hearing, eyesight, check for any neurological deficits, look at their mouth to see whether or not they got any decay or things like that, and to do a general checkup for them. So if we do that at nursery, primary, and secondary, we will be able to pick up any problem that this child might have. And we will use the occasion as well to talk to both children and parents about how to maintain a healthy lifestyle.
Thank you, Doc. Over to Dr. Ganga. Your questions or comments.
Thank you, sir. Thank you, Dr. Anthony. You have presented some welcoming developments on the sector in terms of control by diseases and health issues.
Mhm.
But there is another aspect to the sector which we must be mindful of, and that is healthcare costs. As you know, in North America and other places, costs are escalating. We don't want our situation to get out of hand. So we need a few kind of statistics that would help you and help us. We're not on the ground, we're off base and remote. We need the healthcare statistics to monitor things like drugs and preparations, physicians' contribution, dentists, other services, hospitals, and especially workers' compensation, which is part of Ministry of Labor. So all of this data for economic management of the sector is very, very important. When I look at the statistics, it it doesn't reflect the recent developments. So we need a statistical bureau to monitor also with the getting the right statistics and put it in publications so that anyone can look at the sector and give you credit for the wonderful work that you are doing. It's not a simple task, it's very complex and spatially diverse. So these are challenges, especially with transportation and ambulatory care services. Now, there are two major input streams into the healthcare sector. You have local production or local content value added, and you also have imports. Those data I have not seen, but it's very important to have economic management through looking at these vital statistics for your sector. So what I have found in terms of local production, you have pharmaceuticals, liquid, you have tablets, and you have ointments. That's in the Bank of Guyana report. Now, the liquids production has been down as well as ointment. And the one that's been up was tablets, local production. So we need to have a grip on that, and then show how your sector benefits, or what are the challenges into the sector in terms of those imported inputs. So you have now goods through the import sector, through local production, and then you have services management and cost escalation potential with regard to physicians, hospitals, nurses, and all other services, especially, like I said, transportation, because you're dealing with a spatially distributed sector. So the question then would be, um, what plans are there to centralize the economic management data to assist you with the task that you face?
Well, I think you raise a very important issue there. Uh, the ministry used to have a strong department, planning department, that we are now trying to rebuild. And we also used to have a health economist that would help us to gather some of the information that you're probably looking for. And we haven't had a health economist in the ministry for quite some time now. I've been talking to some international partners, and they're working to help us to get a health economist to come in and to work with the ministry. So once we do that, I think we'll be better able to get some of the data that you're talking about. But in terms of manufacturing, the ministry does not um, do manufacturing per se, but we do regulate um, entities that do manufacturing to ensure that they have good quality. So the private sector in Guyana are the ones who do manufacturing. And I guess it's about demand and supply. So maybe that's the reason why the ointments and some of the liquids are a little bit depressed at this point in time. But they manufacture and they sell. They get their own markets and they sell. Um, I think some of the products that we manufacture in Guyana, they also export them to some of the other Caribbean countries. Now, in the more medium to long term, one of the things that we're looking at is to develop a biomedical hub in Guyana where we can expand manufacturing of pharmaceuticals. We have been in discussions about the possible production of vaccines in Guyana, and we have spoken to a number of partners pertaining to this. And we are also looking at the possibility of manufacturing diagnostic kits and other medical devices. So lots of interest in this area. So outside of providing care, this can possibly be another industry that can grow. And there have been a lot of private sector interests in developing this biomedical hub. So both from the local private sector and the international private sector.
Dr. Rang, a follow-up question.
Yes, so in terms of whether the local private sector is fulfilling expectations, you need to monitor in a broad way, not in a detailed entrepreneurial way. They should be able to pick that up. But from your desk, you should be able to see, well, look, something is not going in the right direction, or they're not pulling their weight in terms of what you expect. When I looked at the GDP growth for the health sector, it's only showing 3%, and the cost of living indication for the health sector is the same 3%. That clearly, that's not accurate, in my opinion. So you need to make that perhaps the starting point to get proper data for economic management, and also the welcoming news about the health economist. That person can write proposals for partnership in different areas, from manufacturing to services delivery, and seek international aid for that. So
Yeah,
that's a good value added that will come to the through your ministry to the rest of the economy. So we need to do that as quickly as possible, and that person can also lead a drive for the economic data that you would need to monitor the sector.
yeah, indeed. So that's what we're working on.
All right. Dr. Frank, I know there has been a lot of interest, especially from people in the diaspora, about the role that Mount Sinai and Northwell Hospital is playing in Guyana. Can you please give our viewers an update on this?
Sure. With Mount Sinai, we have a number of things that we're doing. So one area of work that we have ongoing is to develop primary health care. So the things that I spoke about in terms of diabetes, later on we'll develop more detailed cardiovascular care. Um, this is all work that we're doing with Mount Sinai. In addition, the school health program that we have started, this is another partnership that we have with them. We are also looking at some of the low-hanging fruits that we're looking at would be to improve our pathology services in Guyana. So right now, if somebody, we take a specimen, sometimes it takes maybe about 3 to 6 months before you can get back um, pathology results. That's because of the volume of specimens, and we don't have enough people. So one way of addressing that is that we want to introduce telepathology. So this is going to be new. We are going to procure the equipment. We're training people, and when we do the imaging for the organ or the tissue, we'll be able to send that to Mount Sinai so that they can do the analysis and then send us back the result. So this is another form of development that we have. In addition to that, we are working with them on a more medium-term project, and that is to build out cardiovascular services, improve cardiovascular services in Guyana, and to improve oncology services in Guyana. So this is more a medium-term project, and it would take a lot of investment and things for us to improve in this direction. But they have been meeting with our staff, they've been working with them, and we're seeing improvements. In addition to the clinical side of things that they've been working on, Mount Sinai Morningside Hospital is directly twinned with Georgetown Hospital, the management and staff of the Georgetown Hospital. And so they have been working to bring innovations that they have at Mount Sinai Morningside Hospital to Georgetown, and helping us to improve the management style, trying to cut down on waiting times, looking at parameters that we can monitor so that we can improve the services that we are offering. We are also working with them to improve medical health records. So in a couple of weeks, you would see us put out a tender to get a vendor to help us to develop software for medical health records. So all this work is going on. Sometimes, it's you only see the front end of the thing a couple months down the road, but it requires a lot of background work to get what we're seeing a couple months from now. So it has been so far a very productive relationship, and lots of work has gone into this. We have benefited from many experts coming in from the US to work with our local team And I think that type of collaboration is helping to change how we do medicine in Guyana. So one good example, um, during the Madhya tragedy, we had to identify the children who were severely burnt. And so one way we were able to do that was we took DNA samples from the children and we took from their mothers. And within 48 hours, we were able to do the matching. And that was done because those samples came up to Mount Sinai and their pathology staff was able to work around the clock and give us those results. So they have lots of capabilities. And as we are working together, our local experts are learning tremendously from the staff at Mount Sinai. In terms of Northwell, again, we have a partnership with Northwell through their global health program. And through that partnership, you have persons from Northwell who's coming down to Guyana. They're able to do medicine in Guyana. And they have invited us to send up persons to Northwell that would do observerships. We have, I think, 3 persons who would be in their obstetrics and urology department to do some observerships. And so it's a good educational exchange that we have with Northwell. In addition to that, as you would know, one of the child that was injured in the Madhya fire was accepted in Northwell Hospital for treatment of burns. That child is currently in the ICU at Northwell, and they have been doing remarkable work with her. They have been able to take out the tubes. She's now speaking, conscious, and they'll over the next couple of weeks they'll continue to do grafting of her skin. She had probably about 30 to 40% burns, so they're doing that type of reconstructive surgery for her, and she is on her way to recover. So great work because of these partnerships, and we are very grateful that we can collaborate with these prestigious U.S. institutions.
Um, yeah, that's great news to hear about the child recovery. Um, I know your ministry is also responsible for suicide to some extent. I think Columbia University was interested in doing a study. Can you please give us an update on that?
Yeah, so in mental health, one of the areas of mental health that we are closely looking at is reduction of suicide. As you would know that we had until recently on the books that if you attempted suicide, you can be jailed for 2 years. So we have removed that. We have new law that now looks more at the preventative aspects. And I think that's a very positive thing. In terms of working with Columbia University, we have several research projects with them. We currently have, I think, 3 research projects. They're all funded by the NIH, and they look at different aspects of suicide and mental health. And so, with the results that we'll be getting from these studies, we'll have a better understanding of the factors that would cause people to commit suicide and use that then to develop preventative programs. So, this is ongoing work. Some of these studies would last for 5 years. But as findings become known, we have been incorporating that into our programs.
So right now, is there an active suicide prevention program like the Gatekeepers program, for example?
Yeah, we have several programs that we are doing, including one where using the WHO protocol of MH-GAP, we've been training primary healthcare physicians, and that would continue. We want every primary healthcare physician to be trained in detection of depression and other medical conditions that can result in suicide. So that's one aspect. And once they're able to detect people, then how to counsel them, how to work with them to prevent this from happening.
About
So far, I think we've been getting positive results. We also have another program that is funded by Canada. They have given the IDRF 2.1 million Canadian dollars. And this organization has been working in Guyana to do resilience training in various communities. And they're working with a methodology to be able to train people to become more resilient. So that's another project that is ongoing.
some time ago, we received a complaint from the suicide hotline that the person was not responsive to a call that relates to the university lecturer, the young man from West Coast who was a lecturer in physics.
Mhm.
Apparently, he had some issues with his girlfriend. He was rejected and he called for help because he couldn't, and he didn't get the help within a time span because the claim was that they didn't get a prompt response from the headline and he committed suicide. I'm sure you know about the story. And I don't know if any investigation was conducted into that. I tried to raise that with the Ministry of Human Resources, but they said they don't control that hotline. It's being controlled by the Ministry of Health. Do you
Well,
have any recollection of that case? I
yeah,
mean, there may be other cases as well.
I'm not aware of that. I don't know of this story. Um, but we do have a Department of Mental Health that deals with things like this. So we have a hotline in the ministry, and more recently, we also launched a website. So persons can reach out. And the website have video capabilities where you can talk to the person one on one and things like that. And we have persons who have been trained to man that website video conferencing on a 24-hour basis. And this has been operational. So, you know, maybe there are some misses, but obviously we do try to help people who are in need. In addition to that, what you should also know is that we have a response team. So we have a psychiatrist and a number of psychologists that can be on standby. So if, for example, it is determined that somebody is suicidal, that response team can go out and try to help that person. But not only suicidal person. From time to time, we do have persons who have some mental illness, and if they're off their meds, they can, have whatever behavior that the public might think is, endangering them. So when they call us, we are able to send that unit out to assist those patients, and that has been working quite well. So we are not perfect, but we are trying to work to make sure that we can cover these gaps that we
Yeah.
have. It should
Uh,
also be noted, that a lot of our psychiatric service used to be in Georgetown, but now we have Georgetown and Region 6. But now, apart from that, we have psychiatric services now in Regions 3, in Regions 2, because we have a psychiatrist that goes out there in Regions 10, and we have mobile services that would go to the other regions. These psychiatrists would go out to the other regions to see patients. So we're trying to expand the range of services that we're offering. And with the recent tragedy in Madia, one of the things that we did was to send persons to Madia, both psychiatrists and psychologists, to assist the family and also people in the community. But out of this, we have also put a telemedicine hub in Carisparu, in Chinapao, in El Paso, so that if persons need further assistance, they can come to the health center, and one of our psychiatrists can connect and offer telepsychiatry services to those persons. And if the psychiatrist determine that that person would probably need further assistance, we can bring them out to Georgetown where they can get further assistance. So
Mm,
a lot of interesting things are we're
yeah.
using, tools that we're using, and I
Mhm.
think it's helping us to reach more people.
Yeah. Thank you. Before I pass on to Dr. Ganga, I'd like you to give us an update on the new hospitals that are being constructed and the locations, and what are the basic type of service you provide, including advanced state-of-the-art technology in them.
So we're working on a number of hospitals currently. We have a regional hospital at Lima that is currently under construction. Um, we have one at Dikendren in Region 3. So that would cover the Parika Tushin area, because as you know, that's a large growth pole that we have there. We are building one on the east bank of Demerara, a diamond, where the new highway is going to pass. So we have strategically placed a hospital there, and we are building one at Enmore, where the existing polyclinic is located. So we're building a hospital there. Another hospital is being constructed at Bath, and you would have seen recently the president went there for the commissioning of that project. And we have one that would be at Skeldon. Now, all of these hospitals would have a 24-hour accident and emergency service. We have a 75-bed inpatient facility, so people get sick, they got to be hospitalized. We have 75 beds that can accommodate them. We'll be able to do surgery because we have two main operating theater. We have a minor theater that for small things that you need to do. We have a, a good lab with all the diagnostics, and we'll have a large imaging suite that would include ultrasound, x-rays, CT scans, and so forth. And of course, you'll have a number of outpatient clinics. So these hospitals are all scheduled to be completed by 2025, and they're all currently under construction. So these are 6 hospitals right now that we have under construction. In addition to that, we have started the construction of a maternal and pediatric hospital. This is a 256-bed hospital, 100 beds for pregnant women with complications, and the rest of the beds would be for children. And this would provide subspecialty care, including those kids with cardiac issues, oncology issues. And right now, we have a number of doctors we are working with various partners to provide subspecialty training for these doctors. So when this hospital opens, we'll have some of the specialists, local specialists, working there. So while we work on this, we are also right now working with the Indian government to upgrade Bartika Hospital. And so later in the year, we should start the Bartika Hospital. That would be an investment of close to 15 million US dollars. Um, we are also working with the IDB. We have a loan of $97 million, and we will be upgrading the Lethem Hospital. We are building a new hospital at Keto. We are building a new hospital in Camarang, and we are building a new hospital in Maruka. And all of these hospitals would have good operating theaters, labs, CT scans. So whatever you will get in the on the coastland, you can get similar facilities in any one of the regions in Guyana. And all of this would be connected so that we can then move images from, let's say, Region 8 onto a cloud, pull it down back in Georgetown Hospital, read it, and send back the results to the doctors were doing.
Mhm.
So we'll be using a lot of technology to help us to improve
Mhm.
care that we are offering. In addition to that, for the interior locations, we're building good accommodation for the staff that would be manning these facilities.
Yeah, but so I was going to ask you, all these new facilities, hospitals that you're building, are you preparing the staff? Do you have the requisite staff to fill the necessary vacancies there?
Well, it's a challenge because, as you know, there's a global migration of medical workers moving, let's say, from the Caribbean into North America to UK and so forth. So there's a big challenge. I think the WHO estimate that there are probably 15 million persons that are needed globally for these posts, medical posts. One of the initiatives, because we recognize we need to train more, we have three nursing schools. Uh, the nursing schools, the capacity is about 250 persons per year. That's not enough. So just last Monday, we launched a program where we're going to start training. This first batch, we have 1,162 people in that batch. And what we have done is to move the nursing curriculum online. We're using the Coursera platform, um, and we have our content there. We are allowing the students to have access to that, and we'll monitor them for the theory. Our local staff have been able to prepare the videos and put it in the Coursera format. So they'll the same thing that they would have learned in a classroom in Guyana, they can go online and be able to see all of that and learn that, do the quizzes, do the things and so forth. Once they complete theory, we have a number of simulation centers that we're building out, and we are going to bring those nurses in training to these simulation centers so that they can get the practical component done in the simulation centers. So we expect that in 3 years' time, at least we should have 1,000 nurses graduating. Next year, we're going to take in another batch of 1,000, maybe more, and the following year, another 1,000. As I keep saying to people, each one of these students that we now have in training, they'll be receiving a stipend from us of 16,000 Guyana dollars uh, to assist them with whatever they want to use that for. So whether they want to pay for internet, they'll get 16,000 Guyana dollars per month. Once they complete their training and they've been successful, the government of Guyana would give them a job. Their starting salary would be 169,000. So that's what we're working on right now.
Mhm.
And I think so far the response has been great. As I said, we have 1,162 persons starting the program, and we'll work with them to help them through and to make sure that we get a lot of people graduating in the end.
Thank, thank you, Minister Dr. Ganga.
Yes, thanks for presenting information on the, I think it was a Sukibo with the physics teacher and the phone calls and so forth. What this tells us is that the cases that are being identified are extremely sensitive, and we need to correspondingly integrate our systems for information infrastructure to cover these professionally and adequately.
Mhm.
So we may have early warning systems and detection. You need a professional person or a doctor to be in charge of that early warning system. Then you have the issue of data confidentiality, because this has a high social stigma attached to these cases. So we need again another professional sworn to secrecy and other things and confidentiality to be at the top of that. And then the staffing itself should be directly under your control and monitor. So the question is, well, it's a comment. I, because things are in progress, it's moving. You are in that direction, but we need to be mindful about data confidentiality and protection, and the staffing, especially, to be professional people and not a clerk to be in charge of confidential data regarding a particular case. It has to be
Well,
locked
one of the
down.
things one of the things that you'll be very pleased to note is that we would be bringing legislation pertaining to data confidentiality and privacy.
Yeah.
And I can tell you that in that piece of legislation that the Prime Minister would be laying in Parliament, that if you breach patients' confidentiality, um, the fines in that under that legislation, it starts at 20 million Guyana dollars, and it can go as high as $100 million. So that's how serious we are taking this whole issue of confidentiality and privacy. Um, because in anticipation of some of the electronic health records and other types of systems that we are building, if people try to steal the data, then you face some very, very serious consequences. And that's why this piece of legislation is going to go to Parliament. And it's patterned after the legislation that you have in Europe. And it's quite a comprehensive piece of legislation. It's about 98 pages of legislation. So, and one aspect deals with confidentiality and privacy.
Okay. Shamiz, do you have any questions from our viewers?
I do have a question,
Go ahead.
and this question is from Jailal. Is the Ministry of Health program for medical care home services, that is, doctors and nurses visiting patients confined at home for various illnesses?
We don't have a comprehensive program for the whole of Guyana. We do some home services in Region 6, and we do some for Region 4. But as I said, it's not a comprehensive program. So this is one of the areas that probably we'll have to build out.
Perfect, thank you.
Are you planning to extend that program to other regions, the home care?
It's something that we'll have to work on because it's challenging trying to share the resources between the institutions that we have to run and getting people to go to the homes. So that's why we have experimented with it to see how we can improve that. But we do recognize that there are quite a number of persons perhaps that would have, let's say, a stroke, for example, or some form of paralysis. They're home and they need some form of care. And it's very, very often it's extremely difficult for those patients to come to the hospital to access care. So it's important that we get somebody to go out and check them at their home. So it's something that we have to work on.
Yeah. Someone from Canada called and they want to know what's the status of COVID in Guyana, whether it's officially end or it's still there's this alert that COVID is still around.
Like with most countries, you do have cases. But what we have noticed now is that cases are rather mild, and therefore you're not seeing hospitalizations. We do have the hospital at Lilindale, where we have about 198 beds, and we have an ICU and so forth. So far, we haven't had patients with COVID being hospitalized because, as I said, you're seeing a much milder form. Now, we have repurposed that hospital to keep other patients, and we have been looking at patients with other types of infectious diseases, such as TB and other things. So we maintain the staff, but just in case if there's a surge, we have mechanisms in place to move very quickly to deal with those patients. We have also been doing our vaccinations, although right now not a lot of people are coming for booster doses. But in Guyana, we do have the bivalent vaccines that has the ancestral strain and some of the current strain. So which is really good. It's the same thing that you have in the US. So we have that here. And as part of our treatment protocol, we also have Paxlovid. So if somebody do get infected and they need treatment, we have Paxlovid available for them. So our protocol is almost a similar thing that how you would treat a patient in the US, and we have the medications
All
available.
right. Thank you, Doc. Dr. Ganger, your final comment?
Well, yes. Oh, okay. So, what we could do to assist Minister Anthony would be to get the data on the sourcing of imports that are input into the healthcare sector. We need to have information on the suppliers and also the stock levels of the different inputs that you use in the entire system needs to be monitored. So both imports, suppliers, and stock levels, we need to have that reviewed constantly.
Yeah, I agree with you. And one of the things that we're working on is to computerize our uh, logistics and procurement, logistics, and distribution system. So right now, only part of that system is automated in a sense, and that is the warehouse. But we want to automate the entire process. We've had a couple of partners who have assisted us. USAID was in Guyana helping us to look at this complete chain. And so, one of the things that you will see us do over the next year or so is to start looking at regional warehousing, so that when products go out to these regions, that they're adequately distributed. And if we have products there that we need to bring back centrally and redistribute, the system must be sensitive enough to be able to do that. So it's a work in progress, and we there's a lot of work to be done in that area. So that's
Thank
something.
you. Shamiza, over to you.
Thank you, Dr. Tara. Dr. Frank Anthony, can we have your closing remarks for tonight?
Well, I just want to say thank you for having me, and I think we need to do this more often. We have a lot of things that we do here, and uh, avenues like this give us an opportunity to share with your audience some of the good things that are happening in Guyana and what people can look forward to. So I just want to close in saying that we are working to build a world-class healthcare system here in Guyana, that everyone would can be able to come in and be able to enjoy the benefits of such a system. Takes a lot of hard work. We are looking forward that not only the people here would help us to build that system out, but we know that there are lots of people in the diaspora, experts, doctors, nurses, other healthcare professionals who've had years of experience in North America, and I'm sure they can lend us some support. They can bring that expertise to bear and help us to build the system here in Guyana. So if there are such people out there who want to help, then we are willing to partner with you. So just reach out to us, and we'll be happy to see how we can partner with you.
Thank you very much. And thank you to our moderator, Dr. Tara, our panelist, Dr. Gangaram Das. Thank you, Dr. Frank Anthony, and to our viewers, thank you for joining us this evening. Until next time, I'm your host, Shamiza Ali, and this is the Guyana Dialogue. Good evening, everyone.
Thank you.
Thank
Thank you,
you. Thank you.
Dr. Thank you, Dr. Ganger. Thank you, Shamiza.